There you are.
Hi.
Hi.
Hello, hello.
Hello, hello.
Oh, let's see. I guess I need the slideshow. Just kidding. I do need to figure out where to put what goes on what screen. That will go there.
This one's going to be the tightest one yet, I think.
I know. We can zap people, right, if they go too long?
I think so.
Yeah, okay, good.
You can just press the
Collar or something.
Some sort of simulated.
Just press their mute button.
Hmm.
I'll try to wave my hands so I can make the thing happen behind me. Is it going to do it? Remember I had the balloons
That's what I
coming
was
up?
thinking about.
Oh yeah. Oh yeah, that didn't right. That was
Hasn't happened
so
lately. I don't know what happened.
you
I
lost
guess
your
it's more.
superpowers.
Yeah, well, I've been trying to be a little bit less expressive with my hand motion.
That's not like a
You
good
see
light
fire
bulb.
coming out of your ears.
Yeah. So,
Sounds
well,
like
before people start joining, Ariana, I don't know if you noticed that I put a link to the page that has the roadmap and other stuff in the facilitator's agenda. I was thinking that we could drop it in the chat. I was wondering if you could do that.
The
Yeah, I
roadmap,
don't
did you
see
say?
it, though.
Yeah, because I think we can just,
Oh, I
you know,
see it.
I already know some people that are going to be new here, like a bunch
I
of
see.
Rido people. So I think we should
Yeah.
just take a minute and let people know where they can go for more information.
Got it. Yeah.
Mhm. So
Well, it's 11:59.
are we letting them in?
I think so, yeah. Why don't I have an emit? Oh yeah, there we go. Emit all. We're gonna have to keep emitting people, by the way.
I think I can make the lobby go away.
Yeah.
Everybody has their cameras. Not everybody.
Good afternoon, everyone. We're going to give folks just another minute to finish joining, and then we'll get started.
Good morning.
Morning. While we're waiting, if folks could put their name and organization in the chat, that would be great.
No problem.
Hey team, I got a list saying the chat is unavailable, unfortunately. I don't know if I get that same, maybe it's error on my side. Oh, there. No.
I'm getting that same message as well.
So if you are not on mute, if you wouldn't mind putting yourself on mute, that would be helpful. Okay. Rick, are you okay if I start?
Yes, absolutely.
All right. Good morning, everyone. I'm Kristen LaHoulier. I am a facilitator and consultant. I've been working with the Rhode Island Health and Human Services Workforce Planning Initiative for a couple of years now. And today I get to be the facilitator of this conversation. This meeting is a meeting that we try to have regularly. The goal is to kind of pull together our large group of public and private stakeholders for updates, make sure that everyone is on the same page and staying informed on all the different pieces that are moving. And just for a little bit of context, I see a lot of new faces in the room. Wanted to just provide a little background on how we got to today. In 2022, there was an initial collaboration between the executive. Is there any way to put folks on mute, Ariana or Rick? Are you able to do that?
Yes, but I accidentally muted you too. It's a nice mute
I was
all
going to say,
button.
upset for me, but I. So there was a partnership between HHS, DLT, and BMC to come together and try to pull as many stakeholders as possible from across the system, both public and private, to think about strategies for addressing Rhode Island's health and human services workforce challenges. And since then, that partnership has grown significantly with many more state agencies and also close to, I think we now have over 600 individuals and close to 200 organizations that are coming to the table in some form or another. And the one thing I want to just kind of anchor us back to is that during the first year of the process, one of the things that came out of that work and all of the identification of the issues and the challenges and the strategies was something called a roadmap. And we have to say road in Rhode Island, but we have a roadmap. And Ariana is going to drop a link in the chat. If you haven't been involved to date and you're coming to the table, there's a great resource on the EOHHS website that gives you a lot of the background information, including the roadmap of strategies, which is quite comprehensive. And it means that there's a lot going on and there's a focus on both short-term and long-term strategies. And some of that work is being centrally project managed by the project management team of this particular initiative, but there's a lot of interconnected and aligned work that is happening with lots of different groups and people. And part of the role of this initiative is to kind of row in the same direction, keep people, keeping ourselves informed and aligned. And so that's why we have these meetings, is to make sure that we can both share the internally coordinated process, but also spotlight and share and amplify the work of the good work of all the related initiatives that are happening there in the state. So today we're going to hear updates on several workforce initiatives that are going on. We also have a spotlight on the Health and Professional Equity Initiative. And Demarilis Cruz from OPC is going to share some of the outcomes and progress. And we also happen to have two participants in that program with us today to tell us a little bit about their experience. And just in case you've never participated in one of these meetings, we call these speed updates. We're going to move quite quickly. What we encourage you to do is put your questions and comments in the chat, and we will make sure and try our best to kind of address them during the meeting. And if for some reason we can't, we will be sure to follow up. And there's also likely to be a few minutes at the very end for open questions as well. So we're going to start with an update on the Rhode Island healthcare system planning work, and Marty Rosenberg is going to share progress on that and talk about the interface that's been established for how that work is really connecting to the Health Workforce Planning Initiative.
Great. Thank you so much, Kristen. I'm happy to be here and happy to see so many folks here. So as Kristen noted, one of the key things that we are trying to do at the Executive Office of Health and Human Services, EOHHS, is make sure that these planning processes are aligned, and that since a lot of us are working on multiple pieces of them, we're able to make sure that both hands know what each others are doing. The healthcare system planning process has an overarching goal of high quality, affordable, equitable, accessible, culturally and linguistically appropriate healthcare system. And the background here is that we know that there is a lot of planning going on in state government and outside of state government. This is a key piece of it, but sometimes it happens in silos and there are places where it's not aligned. So this planning process aims to align across a range of sectors, which I'll get into in a moment. And this was created, this new process of planning, this alignment was created by Governor's executive order in February, and has created a healthcare cabinet that includes all of the EOHHS offices. So it includes the Department of Health and BHDDH, Behavioral Health, Children, Youth, and Families, Department of Human Services, plus the Office of Veteran Services and the Office of Healthy Aging, plus Health Source RI, the Office of the Health Insurance Commissioner, and the Office of the Post-Secondary. So it really tries to be a health in all policies kind of an approach. The process, it aims to use data, include a broad and inclusive group of stakeholders, coordinate amongst each other, looking at the current needs, but also the future needs. We need to be able to do both of those at the same time, and is overseen, as noted, by the cabinet. There are some additional goals that the process has, and those are I realize I don't have them on the slide, but let me just go over them quickly. We want to ensure access to affordable, quality, and easy to navigate comprehensive care. We want to look at solvency and equity and integration. So, we talk about primary care integrated with behavioral health, but also seamless transitions for patients and system preparedness, patient-centered care. We want to look at preventive primary care and behavioral health. We want to look at oral health. And of course, we want to invest in efforts to address the social factors that impact health, so social determinants of health. So if you go to the next slide, as I noted, we have split in that one, yes. We've split into 5 sectors. We've looked at the health system in 5 sectors. These are in alphabetical order: behavioral health, health-related social needs, so social determinants, hospitals, long-term care and healthy aging, and primary care. Primary care includes oral health. Are these the only ways of thinking about our healthcare system? No. But we needed a way to just organize it in our heads. And the most important thing I can say about this slide is that we have heard loud and clear from our community partners, some of whom are no doubt on this call, that we cannot think of these in siloed ways. So we can think about them as sectors and we can organize some of our work around them, but everybody realizes that you can't pull apart hospitals and primary care, because primary care refers to hospitals and hospitals own primary care. We know we can't separate out primary care from behavioral health because we need to think about things as integrated. Oops, we've lost the slide. And if you can go to the next slide, there are cross-cutting issues and structures on top of this, again, in alphabetical order: data, equity, the health information exchange, which is the way that patients can get their data organized, quality of our care, value-based payments and payment-related models, and then workforce transformation here. So when we have our first deliverable is a report in December. And if you go to the next slide, talk about next steps. Our work groups are meeting throughout the fall. The cabinet is going to release a report in December with a series of recommendations in every area. And that's going to be by the sectors. And then the cross-cutting issues are going to sort of be on top of those. I will also let you know we're thinking about these as chapters. There will be a chapter in the report on workforce, and each one of those sectors is also going to think about workforce. So, as we've been saying, we're starting this conversation in the middle. We're not starting from scratch. And the work of this team and the work that you're going to hear more about is fully integrated in our minds. Will December report be perfect? No, it's not going to be perfect, and it's not going to be a plan. There's going to be a lot where we say, this is going to take a lot more time and depth to review, but it's a really good start, and it's including a lot of people, and we really hope that we see this continuing to move along and creating some state structures where this planning can be ongoing and lose the feeling of being ad hoc. We're really going to create an ongoing planning process, and workforce is going to be at the key. At the center of it. So that is my report. I hope I stayed within my 5 minutes, and I'll happy answer questions when it's appropriate.
Thank you, Marty. I appreciate that. And folks, if you have questions for Marty about this, feel free to plop them in the chat, and we'll get back to you on them. Next, I'm going to bring Manny to the front, and he's going to talk about the Primary Care Training Sites program. Manny?
Awesome. Well, good afternoon, everyone. Pleasure to see familiar faces and meet new faces. I'm Manny Ortiz. I oversee the Office of Primary Care and Rural Health at RIDO. And wanted to talk to you quickly about a new program that was established in law and in the budget in June. The primary care training site programs, under the law, it says that it's intended to provide training for physician, nurse practitioners, and physician assistants within the Department of Health. But realistically, the program is actually trying to address the primary care workforce shortage by recruiting, training, retaining, and sustaining a pipeline of primary care physicians and clinicians in addressing the challenges in clinical training placements. We see that when these clinicians are being trained, it's hard to find clinical placements within the community, and this program is trying to address that. One of the biggest challenges we've seen is pediatric placements, just to name one of the many that we have learned from the inception of this project. So the strategy for for solving this problem is incentivizing primary care practices to serve as enhanced interdisciplinary sites. We want to ensure that these practices there's a mechanism for financing the training and the preceptor time, establishing a multidisciplinary curriculum so that our clinicians are trained in the most up to speed of primary care training, particularly focused on patient-centered medical homes and working in collaborative team models. And also establishing a learning community where there's an ability for our trainees and our trainers to foster a sense of community, right? That's what's going to ultimately hope to keep them here in Rhode Island. Progress today has been really working on rules and regulations as it is required in law. The law required us to establish rules and regulations. We've also been collaborating with higher education programs to identify the main challenges that they're facing in clinical placements. Collaborating with stakeholders on the design of a curriculum, preceptor training, learning collaboratives. How does that going to look like? How are we going to ensure that all of our voices, especially since these disciplines have unique training aspects to one another, how we're going to mesh them together, right? And ensure that it's going to meet the demands of the actual industry, right? The primary care industry as it's changing, the demands of the employers and what they need in their from their clinicians. And then obviously identifying a mechanism within our procurement process to ensure that we can get these grant dollars out to the community. That has been kind of our focus. So our next steps in this particular aspect is to continue with the rulemaking process. We have to continue through that. That is the requirement in the law. We want to ensure that as soon as those are done, that we're ready to hit the ground going. So horizontally, we're working on grant applications, ensuring that we can engage the PCMH primary care training sites for the next academic year. And I know I have another slide, so I was trying to be quick. I'm happy to answer questions about that program when it's appropriate to, but I have the next one, Health Professional Loan Repayment Program. This program has been around for a while, and again, we're trying to increase primary care, dental, and behavioral health care in medically underserved areas. This program specifically addresses fairly designated health professional shortage areas in Rhode Island, so it's very targeted. It is sponsored through HRSA. That's why it's very targeted. So again, as the name says, loan repayment, we're trying to defray the cost of student education and the burden that it has on our health professionals. We know that folks in primary care space are usually not compensated as much as other health professionals, and this is a key to recruit and retain our healthcare professionals in areas of high needs. The program has been very successful. Historically, the program started back in the mid-90s. 1995 was the first cohort. And since then, we have been able to help 270 health professionals and provided $11.2 million in student aid to help them with their loan repayment. This translates to about 100,000 Rhode Islanders being served from a former or current participant in our program. That's about a good size of Rhode Island's population. Thinking 1.1 million to 1.1 million in terms of the size of Rhode Island. We have seen tremendous growth over the last 10 years, particularly. The 2024 cohort, we're providing $1.4 million to about 53 health professionals. And what the data tells us is that this program actually works. 91% of our clinicians over the last decade continue to work in Rhode Island and have a active license in Rhode Island. So this is a tool that works, and we're hoping to continue to work on this program. Our challenges and barriers that we found is that demand, obviously for loan repayment has increased our capacity to provide aid. We have seen that, about in a given year, we're increasing about 9% in an increase in a given year. In the last year, we increased 140%. So we've definitely seen a lot of growth. And sustaining funding has been the biggest challenge, but we're looking into that. We have a competitive grant application coming up, so we'll definitely be applying to that and promoting the 25 cycle, which is actually going to open up in December. So it's not public yet, but we'll be announcing them through all the public channels. December 16th through February 28th, 2025 is when we'll be accepting applications for the current cycle.
Thank you, Manny. Next, we have Manuela Raposa from the Welcome Back Center.
Good morning. Good afternoon. Sorry. My name is Manuela Raposo. I am the director of the Rhode Island Welcome Back Center. The Rhode Island Welcome Back Center is a nonprofit which provides resources to foreign trained professionals living in Rhode Island. We are one of 12 Welcome Back Centers in the U.S., and collectively we form the Welcome Back Initiative. In 2022, the Rhode Island Welcome Back Center and the Department of Health, Rhode Island Department of Health, partnered in establishing a Rhode Island Welcome Back Center Health Initiative at Rhode Island Department of Health. Rachel Sardina, who is here with me as well, is the program manager at the Rhode Island Department of Health. So since we last chatted, currently we have 37 active participants, and the breakdown of that is we have a speech therapist, surgical instrument technician, a nutritionist, a physical therapist, 2 lab professionals, 3 psychologists, a dentist, 11 nurses, and 16 physicians. These are all from different countries, representing China, Latin America in a major way, Turkey, India, Haiti. 21 of the 37 participants are in ESL classes, which are hosted out of the Genesis Center in Providence, and on average have progressed 5 to 10 points in the CASAS test in a session per session. Some of the outcomes that we can mention today are 19 of our professionals have processed credential evaluations. A nurse passed the Michigan English test, which is a prerequisite to taking the NCLEX. So he is completed the CGFNS process. Sorry for the acronyms, but these are the professional entities that do the credential reviews for foreign trained professionals. The CGFNS is for nurses. So that nurse in particular is in the process of applying for licensure in Rhode Island and permission to take the NCLEX. So he will be entering the workforce fairly soon. We have 3 physicians that are ECFMG certified now and applying for residency. We have 1 physician that passed the first step of their process, which is called the USMLE, and is studying for the second one. 7 physicians are studying for the first step, and 8 physicians are studying for the occupational English test, which is the test that they need to pass in order to proceed to becoming ECFMG certified in order to enter a residency here in the U.S. So aside from that, we were able to increase our case managers' hours from 8 to 20 per week, beginning in November next month, in 2 weeks. We reconfigured the ESL classes so that the lower level is taught on Mondays and Wednesdays, and the higher level will be primarily test prep to help with those English examinations that they need to take. So what are the next steps for the program? Well, finalizing a referral system with Brown University Health, where interested parties will be able to fill out an interest form on the Brown University Health website, which will populate a spreadsheet so that we can recruit from there. I'm very excited about that. And once that system is operational, we're hoping to replicate it with other entities in Rhode Island, healthcare entities in Rhode Island. We're planning new workshops and experiential shadowing tour opportunities and securing an office for the Welcome Back Center so that personal in-person case management can happen. So what policy implications or recommendations are emerging? Recommendations for changing Rhode Island licensing regulations for foreign trained dentists, foreign trained physicians, and hoping to further tighten the language in the nurses regulations as pertains to foreign trained nurses. So how can people get involved? We have an advisory council and 2 subcommittees, policy and advocacy and the experiential learning and alternative pathways. We have a workshop series coming up for 2025, and we are hoping to fill that calendar up with any interested individuals are welcome to contact us, and the contact information is right there. Hopefully I stayed within my 3 minutes.
Thank you,
sorry,
Manuela.
I have a bit of a cold.
That's
but thank
okay. You did great.
Thank you for
Thank
having
you.
me.
I also want to just ask Manny, I think there's a couple questions in the chat that pertain that you might be able to respond to if you could take a look as we move ahead. So we are going to have a spotlight today on the Health Professional Equity Initiative, and Darmelis Cruz and Omar Reyes from OPC are here to talk about that. And I've also brought with them 2 participants. So I'm going to turn it over to Darmelis and Omar.
Hi, yes. So, hi everyone. My name is Omar Reyes. I'm Director of Adult Programs and Student Success here at the Rhode Island Office of the Post-Secondary Commissioner. I'm here with my colleague Darmelis Cruz, who's our Assistant Director in our office. Wanted to talk to you about our Health Professional Equity Initiative, which is a collaboration between the Rhode Island Office of the Post-Secondary Commissioner and the Executive Office of Health and Human Services, and our Rhode Island Reconnect initiative out of the OPC office. So we launched an initiative a few years ago with some funding, some FMAP and HCBS funding to be able to upskill paraprofessionals working in the home and community-based setting, with the idea that a lot of these paraprofessionals really needed some support into getting their licensure, whether it was an LPN getting their RN license, or a CNA getting the LPN license, or a case manager looking to get their MSW or the LMHC credentials so that they could practice. The idea was that we wanted to culturally and linguistically diversify the based setting so that we can provide equitable medical care in the state of Rhode Island to our citizens. The way that we did it was, so we OPC have an initiative called Rhode Island Reconnect that was launched in 2020, designed to get working class adults to attain either a certificate, an associate's degree or bachelor's degree by helping them re-enroll at our institutions and or receive some workforce training. But with this funding and this initiative, we supercharged it because most of what we do is provide address barriers outside of the classroom, things like gas, groceries, transportation. With this initiative, we were able to provide up to $20,000 in tuition payments to eligible paraprofessionals, and we've had some great outcomes. I'm going to turn it over to Darmelis to talk a little bit about sort of our model and what our navigators do and support with.
Good afternoon, everyone. So what makes Rhode Island Reconnect unique is our navigators. So each student is assigned to a navigator. Our navigators do check in with each student regularly, usually like bi-weekly basis. And it's during these meetings that they're able to academically coach the student. They're also able to build a rapport, check in with the student to see how they're doing, what services do they need outside of the classroom, because our program could provide the additional support services. So it's during these meetings that they get to discuss, like, do you need assistance with transportation? Do you need help supplementing your grocery bill? Do you need assistance with technology? And so, and this is, again, in addition to the tuition payments. So our navigators do work one-on-one with each of the students, and they talk about the different support services that they may be needing to get them successfully through the semester.
So so far we've had some really great outcomes, and you'll hear from two of our students today in a few minutes. We could turn over to the next slide if possible, please. Oh, there we go. Okay. So in this initiative, we've had 105 individuals participate from 34 different health HCBS industries in Rhode Island. About 51% of our participants in this initiative identify as people of color and or speak another language, which is something that we're really, really proud of. And we so far have graduated 32 individuals. And we're expected to graduate another 36 by spring of 2025, so by next semester, which is when this funding essentially sunsets. But we are supporting the rest of our 102, the remaining participants, and most of them are due to graduate by spring of 26. Our outcomes have been great. Our students have been very appreciative. We have, and just to break down the data a little bit, so about 30 individuals will be receiving their RN license by spring of 26 so far, and then about 30 will be receiving their MSW, and then the rest are split between ABA, their bachelor's degree in human services, or marriage family licenses or LMHC. So far we have seen the impact that has made, and we're really really excited and proud of this work. At this point, I want to turn it over to two of our students. I'm going to ask Daniel to go first, and then Ilaria to go second.
Hello. My name is Daniel Gonsalves. I'm a residential case manager at the Providence Center. I began at the Providence Center as a security guard, and then my then manager informed me that she thought I had I had a good rapport with clients then, so she advised me to seek case management. I applied for the case manager job, and I've been doing it since. I'm currently a student at Rhode Island College going for my nursing, my Bachelor's of Science degree in nursing. I'm scheduled to graduate in December of 2025. I was currently at Rhode Island College when I heard about the program through my job, and it's been very helpful since. Why I chose nursing? Pretty much because I would like a career where I'm able to help others. I'd like a position in which I can make a positive influence. And also, I enjoy the science aspect of nursing, as well as the options available within the field of nursing and the job security that comes with it. Once I graduate, I'm questioning continuing my education and going to become a nurse practitioner. The program has been very helpful for me in that, obviously, financially, it's assisted me a lot, but also the navigator that I was assigned to, Susan, has been very helpful in that we speak regularly. As it was stated earlier, we speak about bi-weekly, and then she just listens to my experiences, and she gives her own experiences and her opinion on what she thinks I should do. She's always helping me. She's always offering me resources. She's telling me about what's available to me. But the biggest thing, honestly, has been the support in continuing my education, and she just listens. So it's been very helpful. And that's it.
You, Daniel. Ilaria?
Hi,
everyone. Sorry for the delay. I haven't really used Teams all that much before. Good afternoon. My name is Ilaria Fusco. I work at Perspectives Corporation. I do in-home, home-based therapy, applied behavior analysis with individuals on the autism spectrum. So many of us know in this field, we don't make a whole ton of money. So it was very beneficial for me to have even stumbled across a program like this. I was fortunate enough to receive $20,000 from this program, which has really helped me up until today. So I went to Salve Regina University and I obtained my Master's of Science in Behavior Analysis. And this is kind of like a piece to the puzzle in sitting for the BCBA exam, which I have signed up for and I'm scheduled to take next month. Another exciting thing that this program has allowed me to do is I am officially student debt free, which is huge burden, huge weight taken off my shoulders. And again, to speak again to the navigators specifically, I met a wonderful woman named Susan. She's somewhere here on this call. And she was really able to help me continue to push. The biweekly meeting really kind of kept me on track, kept me in line with all my priorities, what I needed to do, whether it be academic or just as a working adult, trying to manage working full time and being a full-time student. So I definitely couldn't have done it without any of these individuals. So thank you.
Thank you so much. Thanks, Omar, and thanks, Darmelis and Daniel and Ilaria. That was fantastic. If you have any questions, you can put them in the chat, and hopefully you all can help monitor them. The other thing I wanted to note is that, Omar, I think you have some questions in the chat too. Folks are pretty excited to learn more. Next, we're going to turn it over to Rick Brooks, who's going to give us a quick update on ladders to licensure.
Thank you so much, and thank you, Omar, Darmelis, and Daniel and Ilaria. This is really inspiring and relates directly to ladders to licensure. Some of you may know that in the past legislative session, our advocates and partners in the community were able to propose legislation that was introduced by Representative Tanzi and Senator Cano to establish a ladders to licensure program which builds upon the good work of the Health Professional Equity Initiative and will enable us to continue to support paraprofessionals in the nursing and behavioral health fields to, just like Daniel and Ilaria did, return to school to pursue a degree and license. In addition, ladders to licensure is intended to support partnerships among employers and also between employers and higher education systems to really develop career ladders that make it more feasible for working adults to have the flexibility in their schedules, to have flexibility in academia, to return to school and get their degree. And they will still be supported as they have been in the past by the Rhode Island Reconnect program navigators. So proposals for ladders to licensure are due this coming Friday. And we are hoping and expecting to receive some excellent proposals, and the program will go into effect starting in January.
Thank you, Rick. Next, I'd like to ask Sam Zwettenbaum from RIDO to come up and talk about the recently released Oral Health Strategic Plan.
Thank you so much. It's great to be here with hearing about some wonderful initiatives. My name's Sam Zwettenbaum. I'm the dental director in the oral health program at RIDO and also in the Medicaid program. And I'm here with Jasmine Franco, who is the oral health program manager. And we want to talk about our dental workforce strategic plan. So the oral health program is fortunate to be grant funded through the Health Resources and Services Administration. And every 4 years, we have to propose innovative proposals. And coming off of COVID, where we saw that access was impacted significantly by dental workforce challenges with retirement of dentists, dental hygienists, and dental assistants, that's what we applied for the grant for, thinking about access. So fortunately, we got the grant and we engaged HRIA, Health Resources in Action, out of Boston, and they collected data, some of the data we had collected already. They did surveys. They did key informant interviews from people from multiple areas of the oral health field. And then we had a series of meetings to put together this dental workforce strategic plan. So it was really important to engage as people from as many sectors as possible, because as Jasmine will talk about later, some of the next steps are going to require that continued engagement. So next step, please. The next slide, please. Sorry. So we have four priority areas. Each of those priority areas have goals. And what you don't see here, but what you can see in the strategic plan is for each of those goals, there are objectives and strategies, and then ultimately tactics. So for example, in the recruitment area, we have an objective just to increase and expand awareness of dental professionals throughout the duration of this strategic plan, because the reality is in many of our high schools and colleges, without knowledge of dental fields, people aren't thinking about dental assisting and dental hygiene. So we need strategies to do that, and then increase the proportion of dental professionals to reflect the racial and ethnic demographics of Rhode Island. We have probably we're significantly low on that, as many fields. So looking at strategies to expose high school students. So we go to junior achievement and expose middle school students. So a bunch of strategies there. And then the other priority areas are looking at satisfaction of dental workers so that they stay here in Rhode Island. And then in the policy and development area, use evidence-based science to inform and support at least 3 policy decisions that foster pathways and address barriers to dental professional licensing. So collaborating with Manuela, as we heard on the back to work strategies. So we encourage you all to look at the dental workforce strategic plan, and I'll turn it over to Jasmine to tell folks how they can get involved.
Thanks, Sam. So as Sam said, our strategic plan was finalized and published in July of this year. And I know these slides are going to go out, so you can actually click that link right there to take a look at it. Our next steps are our action planning. So taking those 4 priority areas that Sam mentioned and start really tackling those activities, the objectives that we've had for each of those 4. We are looking for folks who are interested in participating on those work groups, whether you want to co-lead or even just participate. You don't have to be a dental clinician. We'd like folks from all different fields to come and be a part of this. So my email is also right there at the bottom of that slide, and I'll pop it in the chat as well. I'd love to hear from you guys. And that wraps it up. Thank you so much.
Thank you, Sam. Thank you, Jasmine. Next, I'd like to turn it over to Rick Brooks to give us an update on what's happening with the Health Workforce Data Dashboard and the Rhode Island ecosystem.
Thank you. Many of you have heard before about the Health Workforce Data Dashboard that was produced in the past year and went online last June. Just wanted to share, and perhaps Ariana could drop the link to the dashboard in the chat. But I just wanted to share a few updates with you. We are constantly improving on the dashboard, although many of the improvements need to go through a formal review by what's called data stewards, the representatives of the many different agencies that submit data into the dashboard. We have, by the way, more than 20 different data sources, most importantly, the health professional licensure data and the Department of Labor and Training's wage data is in the dashboard, which gives us the ability to know much more about our licensed health professional workforce than we ever did in the past. We know about the number who are actually working, not just have a license. We know annual earnings, and by setting, by race, by occupation, we know quite a bit about the demographics of our licensed professional workforce. We know the schools that they graduated from. So we can see some real trends in terms of career progression and so forth. In the course of the next month or so, some of the improvements that we've been working on will become public, pending the review of the data and approval of the data stewards. We recently added physician assistant data. We will soon be adding midwives, psychologists, advanced practice nursing specialties, pharmacists, pharm techs, and eventually physician data as well. We've also made some enhancements to the dashboard to make it a little easier to use and to navigate. I want to note that the dashboard is not just a passive tool. We're also very actively analyzing and using the data to support the healthcare system planning work that Marty Rosenberg spoke about earlier, and we will be sharing those recommendations in a report to the Governor and General Assembly, and that will be available to the public as well. So a lot happening with data, workforce data, and more to come.
Thank you, Rick. I'd like to now turn it over to Yolanda Bose from the Care Transformation Collaborative to give us an update on some really interesting work happening with the all-payer claims database and the primary care workforce analysis project.
Thank you. Thank you for having me. My name is Yolanda Bose, and I'm a Senior Program Manager with Care Transformation Collaborative of Rhode Island. So as many of you may have heard, Care Transformation Collaborative convened a task force to address the primary care workforce shortage. Typically, Rhode Island ranks high in reports of primary care providers based on population, but we know that there's a flaw in those estimates because the reality is a severe and critical primary care access shortage. So we developed a strategic roadmap with several goals and objectives to address the primary care workforce shortage. One of those goals was to establish baseline data and performance targets for the primary care workforce using existing and to be developed data sources for ongoing monitoring. So a team from Brown University developed really what we think is a groundbreaking methodology to analyze the all-payer claims database to help define the primary care workforce that's actually delivering care in Rhode Island. So we know, just because somebody has a primary care license, they may be doing research, they may be a hospitalist. So it's difficult to tell just based on licensure which of those providers are actually providing face-to-face care in primary care. So using claims data, they developed this methodology using a defined set of primary care CPT codes. They leveraged multiple data sources to cross-match primary care clinicians using state licensure data and NPI numbers, and they compared those results to other estimates and also by collaborating with some local provider groups to kind of get an idea of what their FTE estimates were. So their progress to date on October 9th at our task force meeting, we heard a presentation from this team with their preliminary results. And what they have come up with using this all-payer claims database is about 1,083 physicians, 401 nurse practitioners, and 133 physician assistants. Now, that's the number of clinicians there are, but that didn't really tell us how much are they practicing primary care. What is kind of the FTE equivalent of those clinicians? So after adjusting for FTE, they really came up with a total of 660 full-time equivalent primary care clinicians. And when you look at the population in Rhode Island, that really equals a shortage. Depending on how you calculate patient panel, it really gives us a current shortage of primary care providers of 70 to maybe more than 250 clinicians. So, as I said, these are preliminary results. Some of the challenges with the analysis is some limitations in claims. So not all providers are included in the all-payer claims database. There are some types of providers like the VA providers that are not their claims are not going into the APCD. There's also some inconsistencies with licensure data and out-of-state providers that are caring for Rhode Island residents. There's also some inconsistencies in billing practices. Individual providers can, often code and bill in different ways that can affect the results. The next steps, the team is continuing to review and refine the results, and hopefully we'll be able to make the data public and actionable, and hopefully share the methodology nationally. And so I want to recognize and thank the people who worked on this project and continue to work on the project. Malak Barshay, Dr. Carolyn Richardson, Dr. Neil Sarkar, Dr. Jeffrey Borkin, and Michelle Klein. Thank you.
Thank you, Yolanda. That's really exciting.
It's very exciting. We hope
yeah.
to hear more.
I think we're
Okay.
running a couple minutes ahead, so I don't know if there are any questions. We would be able to take one or two, I think.
I think, Ariana, at the end, we have some space for that. So I think we have two more and then we can open it up. Would be my preference. That's okay. And this is actually the last one, sorry. So Ashley O'Shea from EOHHS is going to give us an update on Caring Careers Campaign 2.0.
I'm Ashley O'Shea. I'm the Director of Strategic Communications here at the Executive Office of Health and Human Services. And I want to acknowledge my partners in this work, Rick and Ariana, who have been supporting us with vendor RDW Group on this multifaceted campaign. So we're driving awareness and engagement to Caring Careers, RI.gov, and we're spurring awareness of job opportunities, specifically those in direct care, and of job training. So you can see right now we have some brochures here that we've been using as well. And this is all in Spanish and English as well. And some takeaways. And in a couple of slides, I'll be showing you where we're distributing some of that. So if you could go to the next slide. So we have a social media campaign, and our assets are in Spanish and Portuguese, and we get this out on different sites based upon an algorithm of folks that may be looking, which is exciting. We also have some online banner displays as well in both Spanish and English. And then I'll go to the next slide. And here's some of our outreach efforts, which we're really excited about. We've been tabling at the Dominican Festival. There were dozens of discussions, more than 200 flyers were distributed. We also had a visit from the mayor, some fun swag. You see some EOH Just bags and water bottles. And that's just an example of one event, but we've done a series of a couple different events and some literature drops at certain job site centers. So we're really trying to get this targeted message out to individuals who may be looking. We know that there's been a lot of news about unemployment lately, but we know that there's individuals that are looking for these types of jobs, and we're just trying to get the information to the right folks in all different ways. So whether they're looking online or on social media or in person, just trying to get the word out on Caring Careers. And I think that's the end of my spiel. We're also, one more. We have some web updates that we're doing. So this is a preview, and it's not as fancy as it's going to look. This is, they call this a wireframe in the web world. So working with our great IT managers, Moises and Bob Martin at the Department of IT with the state of Rhode Island, they helped build this site. To enhance this site, creating a My Career Pathway tool where folks will be able to answer a few select survey questions and go on a path, which is really exciting. So more to come on this, and next time I talk to you, this will be more visually pleasing, this slide. And that's what I have. Thank you all so much.
Thank you, Ashley. So we have a few minutes now for questions, and I just want to open it up to see if anybody would like to ask any of the presenters any follow-up questions that you didn't already put in the chat. Or if you put them in the chat and you didn't feel like they got answered, this is a good time too. Cindy. I think you're on mute. There you go.
Okay, sorry about that. I apologize. I am driving to another meeting, but I just wanted to check in about the Caring Careers. Is there an option for community-based organizations? I know that we had some issues trying to get our organization approved to participate. And and because I think we had to have a physical location where people could come into a clinic. And so I'm just trying to get a little bit more information on whether or not this is something that community-based organizations can also integrate into their staff as an option for their staff members.
I really appreciate that question. If you could send me an email, we definitely want to look into this for you. We partner with the Department of Labor and Training and have their EmployRI listserv post job opportunities for us. And so I'm not sure if you're having challenges posting jobs or posting trainings, but we will dig into this for you because we want to be a partner to you. And between Rick, Ariana, and I and our IT friends and DLT friends, I think we can get you up and running. Rick or Ariana, is there anything else you'd want to add?
I think Cindy, I think we've talked about this previously. You might be talking about with Manny in terms of having your site be eligible for the health professional loan repayment. Is that what you mean, Cindy?
Oh, yes, I think maybe that's, but I think we were told to go through the Caring Careers page originally. I could be wrong,
There's a
but it was
loan
a while ago.
repayment tool. There's a loan repayment eligibility tool, but that should definitely not be where you as an employer should be going. I think Manny would be the best person.
Yeah, I would say,
Okay.
Cindy, yeah, if you want to connect with me, happy to connect with you and make sure that we answer any questions and help you troubleshoot anything you need. It's a great time because our application season starts in December, so you're right on target. Feel free to connect with me. I think I put my email in the chat, so feel free to send me an email. We're happy to connect with you.
Definitely will reach out. Thank you so much.
Thank you. Sandra?
So as far as that was kind of my question on there is because there's a lot of people that think that by looking on the site, it'll show you whether you're qualified or not. And I think it's only through the application that you find out the process of talking to Manny, that you find out if your center or location would qualify.
So on our website, and I'll put it up here. Our website, in Rido's page, our landing page for loan repayment, we have a list of current approved sites as of the last application cycle. And every 2 years we double check. Well, every 2 years the sites that are approved have to recertify. So that's kind of the cyclical nature of it. National Health Service Corps approved sites don't have to because they have to meet higher standards than the loan repayment. But in that website, and I wish I could multitask faster to put the link. But in that website, you'll see a list of sites. And if your site's not there, we literally put it by physical address. Just talk to me and we can make sure that we can connect on that. So I'll put it there. There's a map and also a list to on an Excel sheet. So and that's publicly available. So that's the site.
Thank you, Manny. Cindy, did you have another comment or is your hand still raised from before?
Oh, nope. Sorry, I was still raised from before.
Okay.
Thank you.
Okay, great.
And just one last thing, folks can always apply to the loan repayment program as a site to see if you're eligible, and we're happy to work with you if we find that you're not eligible. We're happy to tell you this is why you didn't meet the criteria, and work with you. We've worked with Lifespan and Care New England and other sites on the sliding fee policies. That's usually is the hiccup sometimes. So if your site, if you use hipsafind.com, the site that I put up there for HRSA, and you are in that location, that physical location that's approved, that's the biggest winner, right? Because you have to be within that geographical bound. Once you're in that bound, we're happy to help you with your policies or any other documents that need to be updated so that you meet that minimum threshold. We want folks to take advantage of the program, and again, happy to partner with anyone who has questions about the process.
Yeah, I
And
think
he
our
has
issue
some-
was that we are community based. I think that was the biggest issue for us, is that we're not a clinic you can come into. It's more, I mean, we have one clinic, but it doesn't service as many people as our agency services. It's more the fact that we're community based and we go to client homes. And I think that was the big issue for us, is we're trying to identify if we would still qualify given that we are community based.
Yeah, the exactly for that one, it's a very particular scenario in that you are you are correct. For I think we connected with you on that one. That one, you have to have a physical location in an outpatient clinic. When you're providing home services, unfortunately, the grant that provides the funds does not include home services as an entity for loan repayment. I apologize about that, but you are correct on that one.
Thank you, Manny. Rick?
And just to clarify, so there's eligibility of the provider site, and then there's eligibility of the employee. The link that I just posted in the chat from Caring Careers is a tool that individual employees can, or prospective employees can use to determine what, if any, loan repayment program they might be eligible for.
Thank you, Rick. There was also a comment in the chat I just want to make sure we've addressed. There was, I think, Andre, I don't know if you're still on, but you had asked if you were thinking about ways to make it easier for folks with behavioral health licenses out of state to get licenses in Rhode Island. And as Sandra put in the chat, there are some behavioral health licensure compacts at various stages, some implemented, some kind of being advocated for. And Rick, I don't know if you know off the top of your head, if you remember exactly the status of those. Do you have any more information to offer? Put you on the spot.
Yeah, you're putting me on the spot because I was just reading the last chat. So
I think the psychology one is well on its way. I think the LMHC, there hasn't been like kind of language around it because that was just announced, what was it, in June. So there are, and I can't speak for, I'm sorry, social workers. I've been keeping track of my own. So I don't know where the other licensures land right now.
yeah, from what I understand from the Department of Health, they are slowly moving forward in implementing several different professional compact memberships for the state of Rhode Island to become part of the compacts. I don't think any of the recent ones have happened yet, but of course the major one was that Rhode Island rejoined the Interstate Nursing Compact back in January.
Yeah. Well, before we're almost done, I want to make sure everybody knows the date of the next meeting. I don't know if Ariane or Rick, if you could throw that back up on the screen.
I'll just put it in the chat. Yeah.
But it is on January 27th, 2025. It will be from 12 to 1. You will get an invitation and a registration link a little closer to the meeting. But if you want to put it in your calendars, that will make sure that you're available. And we really appreciate you all taking the time to come and hear all these updates. If you have updates that you would like to hear more about or things you'd like to know more about, please feel free to reach out and let us know. We try to kind of be varied in what we're talking about, but always willing to take direction as well. So thank you all and have a great rest of your day. There we go. Okay. I think we're
Oh, that's you, Ariana. I see. That's us.
The
I was
audience
like,
thing?
who's
Oh,
who did
I
that?
don't know what that is. I don't know.
You
I did
did
that.
that.
What is it? I
I
don't
knew how
see
to
it.
do that.
It's the
I was
three
a
of us
mom.
in the audience.
Oh,
I think it's Kristen's magic powers again.
I guess.
Hey, that was very
Anyways,
good. That went really well, I
it
think.
did. I was marveling at our divide and I mean, we kind of each took a role and ran with it, and we were pretty efficient. Thank you, Ariana, for getting all that together. You lined up folks beautifully.
And also
thank
thank
you.
you for your response to Cindy Gonzalez.
Yeah.
For,
I know
for
she's asked that before.
translating what she was asking.
I was like, I wasn't sure. I was having that same like, is she talking about caring careers or something else? But you seem to know,
It would
which is
make
good.
sense what she was saying about the employer. I actually was smart to say like, and they think that is like its own issue. But no, she's asked that like 6 months ago, so that's why I remembered because wasn't
Of course, your
that was
mind
good.
can- So it seemed like we had a lot of new faces today. Did you feel like that too? I couldn't really count because there were so many, but it just seemed like a lot of folks we hadn't seen before, which is cool, and also kind of is another reason why these meetings are so important.
Yeah. I'll add them to
Yeah.
the roster. I track the attendance every meeting, and if they're new folks, so I'll send it.
Yeah,
so
for our
we'll know who's
distribution
new.
list. I mean, you got to imagine most of the people who signed up are on our distribution list, but maybe they don't participate regularly.
Some of them weren't though. Like
No,
I think
they
people
just
are forwarding this,
people pass
forwarding
it
it
on.
around.
Yeah.
I'm also was wondering if, I don't know that we're there yet, but I think at some point we might be in a place where we might want to start asking people what they want to know more about. I don't know. I mean, we can think about that, but
Yeah.
anyways. All right. Well,
The two participants from HPEI were great.
they were amazing.
They were just fantastic.
They both did great, and they were impressive and inspiring, and made you want to just throw dollars at that program.
I know, if only we were budget makers.
Okay,
yeah,
so
it's great.
tomorrow we meet at 10:30. I ended up putting off Julia for a little bit because next week's the retreat, and I just was feeling like it was going to distract. I mean, I just felt like we didn't have time.
Sorry.
I just was worried that we didn't have enough time to give Julia the attention she needs to kind of move forward between now and next Thursday, but I could ask her to come tomorrow if you think.
No, the only thing that I was hoping for, and maybe she could do this without, like putting a lot of time into meeting with her now, is I was inclined to update that slide about CNA career progression, backing out the graduates. I mean, the folks who obtained their CNA license while they were at RIC or URI.
The one thing I was confused about when I looked at her data is I didn't see like a very dramatic difference. Did you?